Shall we begin, sir? So then, sir, shall we begin? Good evening, doctors. Today we have another brilliant session. So today we have another brilliant session. I want to welcome you all to the today's evening. Let us begin with silent prayer. We have to show our reverence to our master, Samuel Hahnemann, who is the reason for us being here. And now I want to welcome all of you to this great evening. I want to introduce our speaker, Dr. SEEMA Mahesh, and I also want to welcome one and all to this evening. We'll be having her session on levels of health. This is IHMA National Webinar Series, ILLUMINARE. And now I want to introduce you to the speaker, illustrious Dr. Seema Mahesh. I wish I could read all of her achievements, but uh, time constraint, I will read her a few of her achievements. She is from my alma mater. I'm very happy to share with you, but I haven't seen her. So she completed her BHMS in 2003 from Rajiv Gandhi University, Bangalore, and she also completed her MD in 2007, Organ of Medicine from the same university, Bangalore. She completed her IACH in 2030, and now she is pursuing her PhD, Masters of Science in Medical Sciences, and PhD at Tyler's University, Malaysia, and she has a very uh, what to say dreamable career with renowned classical homeopath from Bangalore who is practicing for the past 17 years. After completing her BHMS as a topper, first topper from Rajiv Gandhi University, gold medalist, she completed her MD in Organon, and uh, she she is learning under Dr. Professor Vital Kos, and further she has been involved in research committee of the academy and currently the director of research at IACH Greece. She is currently in Malaysia pursuing her MSc PhD, and she is instrumental. Her focus in PhD is antipyretic therapy effects in the elderly. She is instrumental in taking the core concepts of homeopathy to propounded by Vital Kos to the conventional medical journals and conferences. And she has been made poster and oral presentations on homeopathic concepts of levels of health, disease and cure, evidenced through case studies and controlled studies at conventional medical conferences on immunology and autoimmunity at New York, Fiji, Dublin, Krakow, Stockholm, Harvard Medical School, Amsterdam, London, Madrid, Vancouver, Tel Aviv, and Istanbul. The presentation at Harvard won the Award of Excellence. Under the guidance of Professor Vital Kos, she has published many peer-reviewed articles, more than 100 articles, most of them in conventional medical journals of impact. She has been invited to teach homeopathy all over the world, including USA, France, Germany, Greece, Australia, Egypt, Turkey, Brazil, Mexico, Malaysia, Thailand, etc. So now we have our speaker for today, Dr. Seema Mahesh. Hello. Yeah, I want to take over, Dr. Seema.
Yeah, hello.
Yeah.
Thank you, Dr. Rekha. It's a pleasure today to be here with so many established homeopaths and I think a lot of students as well First of all, I thank IHMA for keeping the learning unstopped even during these troubled times. It's really important, I believe, to to take an initiative like this. So I would like to start by, okay, let me just share my screen first. Yes. So the topic, as you all know, as you all are aware, is that of Professor George Withulke's theory on levels of health. Now, why do we need this theory is something I will touch upon later. But I would like to say that Professor George Withulke's the way he approaches health and disease and cure concepts is very it's like an extension of Hahnemann's thoughts. It's nothing new. He himself says that it's nothing new, but in today's times we do need certain not exactly additions, but maybe slight modifications to what Hahnemann told us then, to adapt to our new situation health wise. So one such theory is levels of health. If there are a lot of students from ISEH, this might be a repetition, but I hope to give something by the end of the talk. And for those who don't know anything about this, I hope to give enough basics so you may pursue this and learn this by yourselves to apply it in your practice later usefully. So let's start off. First of all, ponder this. We know this because this is there day in and day out in our newspapers today. COVID is more dangerous in the elderly, and it is more dangerous in those with comorbidities such as diabetes and cardiovascular diseases. We know this. Keep this in mind. We will come back to this later, right? I hope to throw some light by the end of this talk. Let's begin by a few questions that bother us clinically, right? Either by yourselves or patients keep asking you these questions. Is this condition curable or not? You know, typically people will ask you, can you cure this condition? Can you cure alopecia? Can you cure diabetes, right? This is something common. And sometimes we ourselves, when we take a case, we get this thought. How long will it take to cure a condition? I don't know where that line came from, I'm sorry. How long will it take? You know, patients will ask you, do you think we should take medicine for 3 months? Do you think we will need for a year? You know, it's a question. And what is the best strategy? You know, we have a lot of strategies. And of course, there are some official strategies which are taught in classical homeopathy. Are we going to use the totality, the keynotes, the causation? You know, it's quite baffling. What are you going to focus on in a case? And once we give the remedy, all hell breaks loose, and we don't know what the patient is actually coming back with. What does this reaction mean? When a patient comes back with a specific reaction after a remedy, what does it mean? Should I change the medicine? Should I change the potency? This is another question which plagues us. And then when you're treating for acute and a patient comes down with, when you're treating for chronic and a patient comes down with acute, should I treat? Should I not treat? No clarity. And there are some other observations. Just follow the thought process. You will get there. There are some other observations we see. Some people live for 100 years. You know, my grandmother, she lived 100 years. Whereas some die even in, you know, early childhood. They cannot survive. They're born with such bad health, right? Sometimes we see, and most of the times we see, it's the same pathology, right? One person's eczema, you will treat within a month. You know, one remedy, one dose, patient is fine, and you know they will They will probably be the ones you put your before and after pictures of in your clinics and, propagate homeopathy with. But others, most of them, will keep coming back to you, will keep taking treatment, right? And nothing really seems to work for them. And in between, you have the others who respond well but will take a long time, but they will do well. So it's the same pathology, eczema, but then there is such a big spectrum of response. Why? Think about it. So these observations were incorporated into a clinically useful prognostic theory by Professor George Vitulkas. He has seen uh, thousands of lakhs of cases in Indian terms, lakhs of cases over 60 years of his practice. And these observations led him one of the theories, the other one, the equally important theory is the continuum theory. And well, that it is kind of interwoven into this theory, but let's not get confused. Levels of health theory is a product of his observations, not conjecturing, but observations. So when we see all these observations in the clinic, and we start realizing that there is some difference in the way people react to diseases, people react to treatment. Now, why exactly or rather, what difference exists between them, right? Why do they have such a wide variety of reaction, response to disease and to treatment? Now, if we get down to the nitty-gritty, let's observe in our daily clinic, what do we see? How do we, what exactly do we appreciate as difference between patients? First of all, even though it's the same, like I just mentioned, even though it's the same diagnosis, the seriousness of the condition of the pathology will be different. For example, take a diabetes case. One person's diabetes over 20 years, very stable. He just takes half a tablet of one of the anti-hyperglycemics. He eats very in moderation. He does his exercise and nothing really bothers him. And the sugar is maintained well. Another case, just diagnosed, maybe 2-3 months, there is such a lot of variation in his blood sugar levels, and so soon they go into organ damage that it is unbelievable as to how soon they end up in such serious conditions. So the diagnosis is the same, right? But the seriousness, the depth of the pathology is different in each individual, right? Second thing we see, which is very different in each individual person, is the past history. What do we mean? So the kind of diseases they have suffered, the infections that they have suffered, the chronic diseases that they have suffered, the kind of treatments they have taken, and the reaction to those treatments, what has happened with those treatments to them. This is a very individualistic story in every person's case, right? This you agree with, I'm sure. And of course, the one thing that is again is responsible for the difference between us is the family history. If not as illustrious as the English royal family, we still have our colorful family histories, don't we? Including the diseases. So you see, these three are the main tangible points of difference that come across and make each individual different from the other, right? Keep these in mind. And in fact, these are the ones, these factors, namely the current diagnosis and its level of affection, to what level it has affected the person, the past history, and the family history, right? These are the major factors which influence the current health status of a person. And in order to in homeopathy, we are trying to kind of reverse the immune status. That is, we're trying to take him back to a state he was in before developing the problem that he has now, right? So in order to understand where he is, what is the nature, why he has landed here, we have to understand these factors. And these factors not only influence the current health status, but they also influence the response to treatment. And in fact, the questions that we asked in the beginning, they will all be answered if we understand these major factors that influence health of a person. Now, the theory. Let me begin at the beginning. You know, at the moment of fertilization, the health potential, right? The health potential, the inherent possibility for health is decided depending on how healthy the parents are, how happy they are when they come together, and the kind of conception that occurs, right? These things determine the energy complex that is available in the organism that results, right? And this is a finite amount of energy. It's not infinite. It cannot be expanded or added upon later. But this is the potential, right? You can spoil it later by your activities, but this is the potential they are born with. Now, this energy, it depends on this. The amount of energy depends on this possibility for health, including for the activity of the immune system. What do I mean? I mean, if an organism is born with a high energy complex, then there is enough energy available for the immune mechanisms to take place. This is not arbitrary, abstract ideas anymore. These are tangible, studied. You can contact me, I can give you the resources. People can actually tell you that there are certain mechanisms by which the energy complex decides how much health is possible in a person, right? So what I'm trying to say is that the better the energy complex available at birth, better the health, right? Better the possibility exists. You can take this person to live healthily for a long time, this possibility. But if the energy complex available at birth itself is very low, then the energy available for the immune system to take the support of the remedy and function and to come back from disease is also low. I hope this is clear. So when efficient, when at its peak, the defense mechanism, what do we mean by defense mechanism here? In simple terms, for homeopaths, it's the same as the vital force of Hahnemann, right? Hahnemann called it vital force. We call it the defense mechanism, just to be a little more modern, that's all, nothing else, right? So when efficient, right, when it is functioning without any hindrance, this defense mechanism's one and only and absolute job is to maintain harmony, keep you alive first, and maintain harmony, right? Harmony means, in physiological terms, homeostasis, right? So it is always trying to keep you functioning at your peak, in terms of physiology. But this we know is not always possible, right? We are always attacked. We are always disturbed. We are always creating disturbance, either externally or internally. We're always disturbed. But the beauty of this defense is that within certain limits, it can actually take in all that disturbance and come back to harmony, right? Because that's its job. But not always. Sometimes the pathological stimulus, what we call the pathological stimulus, right? The one which aims to disturb this smooth flow of health is beyond the ability of the defense mechanism to manage, right? Thanos gets through and breaks the shield, like the pathogenic stimulus, which breaks the ability of the defense mechanism to come back to a harmonious state. So, if this happens, do we die? No, right? We all are living with one or the other disease. So, sure, we are not dead. So, what results with this kind of disturbance is not death, but disease. Once the pathogenic stimulus breaks the ability of the defense mechanism to keep the homeostasis, what the defense does is it continues to keep the person alive, but at a compromised state. And that is the diseased state. Now the disease has set in. But how does it continue to function? It still has to continue to function. It continues by production of symptoms. This is why we say symptoms are a language of the immune system or the defense mechanism. I want to make a point here, since I think a lot of students are here. It's very important to understand what do we mean when we say symptoms in homeopathy, right? This is imperative. If you don't understand this, you will not succeed in understanding most of the teaching in homeopathy. You see, when we say symptoms are language of the immune system, what am I saying? Now, I say diabetes, right? It's the easy example. Diabetes has high blood sugar as the as a sign on which we diagnose, right? But is this what we mean when we say symptoms? No, right? So homeopaths are not looking for the signs of disease. It is what we're looking for is the changes in the defense, in the organism. The organism is functioning in a certain way. A person has a certain temperament, a person has a certain bodily structure, certain physiological attributes, right? His mind works in a certain way, his emotions work in a certain way. But once the disease sets in, right, the pathology sets in, there is a change. There will be a change. Now, this is not, again, fantastic ideas like, imaginary ideas. These are proven by immunological studies today that any sort of inflammatory changes in the body bring about emotional and mental emotional changes as well, right? So what we are looking at, we are not looking at the common diagnostic science. We're looking at what happened to that organism once this pathology established in him, right? So if a person was a calm, contented, happy person, right? And then the diabetes started and he's become irritable, right? He's become, he snaps at people, he uses bad language, and people say that this is not him, right? We are interested in this. Why? Because this is the adjustment that the immune system has done in order to function with the diabetic state. In order to function in an altered, compromised state, it has adjusted some parts of that organism, and these are symptoms. So never confuse the pathological signs as symptoms when we say. So this new state of functioning will depend on the strength of the immune system. What do I mean? I mean, sorry. Okay, too many clicks. I mean, if you have a strong immune system, strong energy complex, strong immune system, right? The symptoms it produces will also be strong enough. What does that mean? What do we mean by a strong symptom in homeopathy? We don't mean strong in terms of intensity alone, right? I have very bad headache. What am I going to do with that symptom, right? You cannot prescribe on a very bad headache. You need the qualifiers of that symptom, which become peculiar and characteristic. And this clarity is a strong symptom. So if your defense is strong, then it will produce a clear, strong symptom. I hope I'm making sense, because when you see in clinic, when you take a case and you just write down fear of dogs, fear of heights, without qualifying, right? Qualifying how strong it is, where it is, what context it is, right? And what happens to the person in response to that, when it started, why it started. We go into a lot of details, right? So we have to make sure we get these details. And then when you look at it, you see the difference between cases. You see one person gives such clear indications, it may not be for a specific remedy, but the clarity of the symptom exists. Individuality comes through, right? So the more the energy complex available for the functioning of the immune system, the stronger is the defense, and therefore stronger or clearer the symptom production. Therefore, like this flossing grandmother, people who are destined to live for 100 years, right, will produce the strongest, most characteristic symptoms. They talk materia medica to you, right? And the best part is that if you treated them, they will give you these dramatic results with just one dose, one remedy, one dose, dramatic results, because the immune system is so strong that just little bit of support, you can just tell them this is some prasad, this is faith healing, all this will work for them because their immune system is so strong. It just needs a little bit of support and it will come back. And you can see her dancing there. I like her. They recover very quickly, minimum dose, and usually a single remedy. But as we go down, now we have spoken about the ideal human with the best energy complex available for all his physiological functions. But we are all not like that, right? We're all at different levels of energy available. So as we go down in this energy complex, the response becomes slower. Not just that, the response, the clarity of symptoms also reduces because the energy to produce symptoms will become lesser and lesser as the disease force starts to become more dominant in these people. So you will only see disease signs. You will not see individualistic symptoms in these as you go lower, right? It is not a sudden drop, but a gradient, right? So we have this ideal state and then the state where there are no individualized symptoms and just the disease and everything in between, right? So it's a gradient. Finally reaching this, like I said, this stage where, or the condition where you don't get any individualistic symptoms, only the disease dominates. The immune system is so weak, it cannot produce its symptoms, right? This is the last incurable state. Now, don't be under the impression that these are terminal cancer cases or something like that. No, it could be a simple allergic rhinitis, right? How many of you have cases of allergic rhinitis following you for like 10 years with not enough changes, right? These are the cases. You look at their case, you will not see individualizing symptoms if you've been doing it right, that is. uh, the reason they do not respond to treatment is not because it's a very overwhelming, deadly pathology, but the immune system is so weak that it cannot produce its own symptoms. So homeopathy kind of becomes limited in these cases. You cannot cure them. So basically, what I'm saying is you can have a very healthy born person developing cancer, but you can have a really weak immune system developing like allergic rhinitis. It's not about the pathology, but about the amount of energy available for the process of cure. You know, so based on these concepts, the health, health factors that influence health and treatment response, the levels of health have been described. Now, don't be under the impression that we have cut and dry levels. Till here it is this level, till here it's this level. No, it's an arbitrary, because if you actually come down to it, each of us have a separate health level from the other person. We cannot be categorized. But for the sake of clinical convenience and to be able to prognosticate the common clinical characteristics, in that spectrum have been put together as a level. So it's not really in biology, as you know, nothing is 100%. It's not math, but there is some semblance of similarity in each of these levels, which help us to understand what is happening in this patient and what we expect in this patient, right? Coming to the levels. So there are 4 groups, A, B, C, and D. Each of these groups is further divided into 3 levels. So we have 12 levels in all. Now, the level 1, like I said, the best level, that is the ones who are born with a possibility for longevity and very good health, right? These are the people in level 1. As we go down, the status of the level decreases, reaching the incurable conditions in the lowest level, in the 12th level. So again, I want to remind you, while pathology is important, of course it's important, right? But it does not independently decide the level. Just because a person comes with, say, Alzheimer's, yes, but cancer is the best example. Just because a person comes to you with cancer doesn't automatically put him in a low level. He could be group A, right? What do we mean? We will see. So what decides when we assess? This is an exercise we get all our students of the academy to do with every case in the beginning, at least. I don't know if they follow it after they become independent practitioners. But what we try and make them do with every case is to make a note on what do you think is the level of health of this person, right? Because unless it's done over and over and over, you don't, it's not automatic, right? It's a very intense thought process in the beginning. So what decides the level of health? First and foremost, the hereditary load. What do I mean? For example, I said diabetes, right? Now, consider a person who has diabetes and his father has diabetes, his mother has diabetes, his siblings have diabetes, right? This one case. Another case, the person will have diabetes because he took some steroid treatment for, say, dengue, right? It's very common that they give some treatment and then there is diabetes and they continue to be diabetic. And when you ask this person, they will say, no, nobody has diabetes in my family. I'm the first person to be diabetic. If you compare these two, what's the difference? The difference is the first person with such heavy hereditary predisposition It need not be to the same disease, right? Just the existence of a heavy family history, say cancers and very severe neurological disorders, psychiatric disorders, right? When the hereditary diseases are heavy, the diagnosis alone will not tell you, right? When you see such heavy hereditary diseases, the level of the depth of the disease will be much deeper. It's going to be very difficult for you to treat a person with such heavy or such um, strong diseases in the background. That's what I mean. So that's one of the factors that decides the level of health. So the more the load, the lower the level. Second thing, most important, is the presence or absence of high fever. What do we mean? You see, if you look around, if in your cases also, people with strong chronic inflammatory diseases like cardiovascular diseases, diabetes, thyroid, all that, they don't generally develop high fevers. They may say they get colds. Some one day they feel a little warm and the next day it's gone, right? They normally don't get um, high fevers. I will come to this. I know a lot of questions have started, but this, but that, yeah, I will address that when we come to the actual levels. But why I'm coming, why this decides, I will tell you. Acute inflammation, efficient acute inflammation, fever is the hallmark, right? Is a characteristic of an efficient immune system, healthy immune system, right? If there is an infection and you're not able to raise a fever, your health level is not good. Because why? We know physiology, and now a lot of immunological studies that we have gone. And yeah, my research is on what happens with antipyretic. Okay, so in my PhD, what I'm doing is I'm studying the effect of antipyretic treatment in the elderly, whether it's beneficial or harmful or just doesn't do anything, right? Um, this is in connection with the continuum theory, but I'm doing mainstream medicine, so I'm hoping to get that experience here. Okay, what I have learned and what I have seen, and this is Professor's uh, observations, which are confirmed through my studies, are that if a person has a chronic state, he will not be able to mount an efficient fever, acute inflammatory reaction. Because acute inflammation is the only way our body has learned to defend itself against infection, against pathogens, right? There are studies which indicate, which have compared whether febrile temperatures are good or a reduction of fever is good. And they started it with lower animals, and they studied that in lizards, a specific kind of lizards, when they reduce the fever, they induce the sepsis, right? They induce sepsis, and they put one group as those who will run the fever, and the other group they reduce the fever. The difference between these two groups, the mortality rate in those in whom the fever was reduced was too high. So they came to the conclusion that fever is essential for survival during sepsis. Now, immunological studies tell us that the only way, our over the evolution, the only way our organisms, right from not just humans, right from the lower animals, the only way immune system has learned to recruit defense cells, right? All the immune cells, the T cells, the B cells, right? They all get recruited only in the febrile temperature. It's a huge metabolic cost because metabolism kicks up a lot during fever, and yet this mechanism has been maintained for so many millennia because over the evolutionary time, because it is essential for survival. If the prostaglandin E2 does not stimulate the preoptic area of the hypothalamus to raise the fever, which is the job, right? The local inflammation does not get taken care of. Say you have a case with pneumonia. The inflammation in the lungs, the cytokines will be stimulated, the cells will be stimulated to contain the inflammation, the infection, only if the preoptic area raises the body temperature to the febrile range, not 9900, but 102 and beyond. And in case this doesn't happen, of course, that's a big study area altogether about the resolution of inflammation. Let's not go there, it's too much into detail. So basically what I'm saying is, first the family history, secondly the presence or absence of high fever and infections besides the health. Third is the clarity of symptoms. This I explained, right? The better your immune strength, the clearer. For homeopathy, the symptoms for homeopathy, not like, again, I keep repeating this because a lot of my students make this mistake. Do not confuse common symptoms of disease or pathology with homeopathic symptoms. That is the symptoms that the immune system is actually telling you, right? So clarity of the symptoms will again decide where the patient falls. And finally, again, we have touched these past medical history, diseases, what was the effect of that disease on that patient? Did they suffer like anything, or they came out of it easily? Did they have to take a lot of treatment, or just a little treatment and the disease went away, right? So these things, there is no shortcut in homeopathy. You simply have to take all these symptoms meticulously in order to do justice. So these decide will help you decide the level of health. Now coming to the actual levels. I know you will have a lot of questions. I will take it. In fact, I think I will finish much earlier. This is my intention to finish a little early so I have enough time for question answers. So I will take the questions in the end. So please feel free to post the questions in the chat box. I think the moderators will help me with that. So first, coming to the actual division of levels. The first level is group A, and the first group is group A, and the levels in it are level 1, 2, and 3. Like I described, these are the healthiest people, like my grandmother, right? And they have the lowest genetic load. What do we mean? If you take their history, they'll say, oh, my parents lived till 100, my parents lived till 90, they never had anything. Towards the end, they had some lung disease or something, I don't know, they died of old age, right? I've seen this written, death due to old age, father died due to old age, right? So this is typically a group A case. And like I said, they can have any disease. You can have cancers in group A, but they will, no matter what diagnosis is in this group, you will be able to cure it homeopathically, right? Because the clarity of symptoms is so good. All your dramatic cases, the ones who, the cases we present in all the seminars are all of this group because it's so dramatic, it's so impressive, right? So another thing that happens in this group, many of you may have been confused with the idea of constitutional medicine, right? You cannot find constitutional medicine in everybody. Is that true? That's because it's only in this group that you will find constitutional medicine. What do we mean by constitutional medicine? That no matter what problem they have, you give that remedy, they will come back. And that is possible only in this group. If they are not, if the immune system is not that healthy, you cannot have this, right? In this group, you will not need many remedies. What do I mean? That just one or two remedies. When they have some problem, they keep what do you say? They keep oscillating between one or two remedies. When they have this acute, they need one remedy, and sometimes they have some other upset, they need the same remedy. So there is not much difference in what language comes through when they are sick, and they don't need repetition, right? You can usually, you don't need to repeat remedies to them. You can go very high, and you can give them one dose, one remedy, one dose, and the patient will be fine for like 10 years. Now, I said high fever is a hallmark of efficient immune system. But in this group, you will not see many acutes. When they get acute, it will be high fever. They will get a fever for like 3 hours, 4 hours, in some 20 years once or so. But, they don't need anything. They will drink some kada, kashaya, all that stuff, or they will eat some home remedies, and they will be fine. But this acute, the episodes of acute are very less. They're not recurrent. You don't get recurrent infections in them. In childhood, they will have some typical childhood diseases. Today, we don't see typical childhood diseases, but these people, the typical chicken pox, measles, only this kind of typical childhood diseases will be seen in childhood. But otherwise, they do not have frequent infections. So they are very healthy in the sense, even exposure to pathogens, their body doesn't, even if there is any invasion, it takes care of it so efficiently that the person does not suffer at all. It's like a smooth functioning machine, right? This is the idea in group A. And in level 1, you will usually see only one remedy being indicated, no matter what the patient has, from common cold to cancer. It will be the same remedy. In level 2 and 3, depending on the situation, you may need 2 or 3 remedies on, different remedies. But you can go very high in them because symptomatology will be very clear. This is another idea. You see, dosage or potency is it's not a very definite science. We are still working at it, right? We don't have definite rules for potency selection, but one of the best rules is that the clearer the picture, the higher you can go. The reason being, when an organism is strong enough to give you a clear picture, it means it is strong enough to be treated, with higher potency. That's the idea. So in this group, these are indicative, of course. These are not absolutes. You have to go by, so like I said, these are basics. There are certain situations where you don't go high. But otherwise, as a general rule, you can go very high in these people. Now, that is the ideal group, right? These are the people, what happened? I will give you an example to make you understand. My grandmother, around the time of my marriage, so she was 80, she died when she was 100. I think she was 83 when I got married. So at that time, she was diagnosed with diabetes, right? She had some symptoms, and we got her blood sugar checked, and sugar is high. And we waited a few weeks, it was still very high. And then Calcarea carb 201 dose, 200 or 1 one dose, right? Blood sugar never rose again, all her life. They used to check her for like the next 5 years, and then they stopped checking because it was always normal. Then when she was 95, I think, she developed herpes. Okay, and you can imagine in the elderly, herpes is very, they suffer a lot. But in her, Mahesh gave her Lachesis 31 dose. In 3 days, the lesions completely dried up. This you will not see in everybody. This kind of miraculous reaction to remedy, and that to one dose, is possible only in group A people, right? So don't expect this kind of drama, this kind of miraculous response in other levels, which are most of our cases anyway. So coming to group B, group B is level 4, 5, and 6. Now, I'm sure all of you have these cases in clinics. Children coming every month with some or the other infection. Before they came to you, they would be taking antibiotics every month. This is the kind of recurrent, strong, severe acutes that occur in this group. This is the group. They have a slightly less powerful immune system. Their immune system has not as much energy as the group A people. They're still pretty healthy, but because they are the immune system is not that healthy, it reacts to every pathogen it comes in contact with. Not every, most of the pathogens, but these are common pathogens, right? Not some facultative organisms or anything. These are common bacterial and viral infections that you will see, right? So here in this group, people will have a slightly higher hereditary load, and the symptomatology is clear. Even in this group, symptomatology will be clear, but it will not go away with one remedy at a shot. You will probably need to repeat a few times, and then after some time, you will need to give another remedy when the new condition arrives. So you have to slowly bring them up to be healthier, right? Another point I forgot to mention, homeopathic aggravation. In group A, it's almost imperceptible because it's quick. The reaction is so quick, you cannot perceive the homeopathic aggravation. But in this group, in group B, they will show really strong aggravation. You have to be very careful. Sometimes it is quite problematic because patients are so scared. Fever is not going down, fever is not going down, right? So in these people, you can have strong homeopathic aggravations, but it's fine. They will be fine. Once the aggravation sets in, we know they're going to be fine. But you have to be prepared, right? So when you're treating a group B case, you expect a strong homeopathic aggravation, okay? And you will repeat till you see aggravation. If you see aggravation, you stop. Because sometimes they need, especially in the acutes, during the acutes, they need repetitions, and you don't go very high in them, but high enough. 10 m, 1 m is fine, it's okay. They are pretty healthy people. They're not sick. They're not degenerative cases. They are okay. They can have chronic problems. Like I said, pathology is not a problem. Diagnosis is not a problem. They can have chronic problems, but they will have concurrently recurrent infections, right? If you have time, or if you remember, you can see one of our papers that we published where the girl was born with an ovarian tumor, right? This is a teratoma with it's a teratomatous tumor which was removed, but the malignancy had not gone down because the alpha fetoprotein was very high. Okay, so such a case was brought, and the only hope we had was that despite being born with cancer, the girl developed tonsillitis every month, right? So the moment we saw this, this is a 3-year-old girl, the parents are really, really distraught. So when we see this, we can give the patient hope, right? So this girl was cured. This is 2005. Okay. So at that time, she was 3 years old. She's still fine. We followed her up, ultrasound, blood markers, everything for over 10 years. And then we stopped. She's fine. So why she is fine? You see, her mother developed breast cancer later. We could not save her. She died. She came to us. We couldn't do much. She went to chemotherapy and then she died. But why this girl was saved is because of the health level. Despite being born with cancer, she developed acute infections, right? That is the indication that this case will respond to, oh, and the, uh, you know, if it's possible, someday we'll show the video of the shift. You know, we talk about shift of problems from deep to superficial. And if you thought it was theory, please remind me to show you this video. Okay, when cancer shifts to skin, not skin cancer, but the pathology cures, the cancer cures, and then the Herring's law of cure, it comes out on the skin. To what level it comes out, that will be an interesting video, I'm sure, for all of you. But these are not mere theories, my friends. These are real observations of great minds, and we will do better to follow what they say, right? So this group, she was born in, that's what I meant. So when you see a case, they have recurrent infections, common bacterial recurrent infections or viral infections, you can be sure that they fall into group B. They will need a lot of treatment, but you can hope to cure them, right? Going to, I hope that's clear, group C. I think this is the easier group to understand for you all, because most of homeopath's cases fall here, right? Where we have chronic degenerative cases such as thyroid, diabetes, asthma, you name it, right? All the autoimmune disorders, everything most of it falls in group C, right? You will observe in these cases, even if they get acutes, it'll be just mild disturbance. I have some cold, I have some body ache, I'll take something, I'm fine. They don't develop fevers, high fevers. Even if they develop fever, it'll be a 99, 100. Even if they get very severe infections like dengue, they will not raise a high fever. It'll be 100, right? Whereas in group B, if they develop dengue, 105. I had a case of 105, right? A child. So, okay, not everybody 105, 103 to 104. Good immune system will raise it to that level. But in this group, you will see 99, 100, max 100. 100 is fever for them, right? And if you go even further low, this is at level 7. 8 and 9, it is even worse. They don't develop acutes at all. Okay. Now, the worst part of this group onwards is that symptom picture is terrible. No clarity, right? They will indicate anywhere between 5 to 10 remedies, right? And this is where our repertories are so valuable to us, right? We don't get keynotes. We don't get, characteristic individualizing symptoms. Why? Because, again, going back to our original idea that the energy available for putting out symptoms by the defense is very low, and they only come out with the disease symptoms, signs, right? So if they have high blood sugar. What do you have? Any other health problem? No, I feel a little tired once in a while. I get up for the loo in the night a couple of times. What are you going to do with that, right? I have a case of vitiligo, which I'm breaking my head over, which is like this. He has nothing else. No mental symptoms, no emotional symptoms, right? He's fine. I'm happy, doctor. I have no problems. Before this, you had any problem? No, doctor. I never had any problems, right? These are the obscured cases where we struggle day in and day out to find the prescriptive symptoms. Now, this is also because they have the low genetic The low energy is because of the higher genetic load in them. They will have family history of a lot of diseases. They may even have past history. In childhood, they had repeated infections which were repeatedly treated. This is also possible, but these are the better cases. Without heavy family history, if it's only suppression, then they are better cases. Then, so in these people, you need to prescribe anywhere between 5 to 10 remedies in sequence. First when they come to you, find the remedy, give them, they become better, and then stagnation. Then you find the next remedy, give them. You have to slowly build their immunity till the point that they will start having aggravation. In all these lower levels, 8 and 9, you will not see any homeopathic aggravation, right? But when you bring them up from 7 and then you push them to 6, if it's possible, it's not possible in everybody, push them to 6, such severe aggravation can happen that you will shake inside, right? But that is the ideal state. Not everybody ascends through these levels easily, and that too, every time you must give the correct remedy. The biggest problem in this level is that, of course, there's the danger of prescribing similar remedies, right? You know what is simillimum and what is similar. So there is a danger of prescribing similar, close remedies, not the exact simillimum. But you know what happens in this group? Because the immune system is already so weak, the similar remedy will further confuse the case. It will make it jumbled up, right? Sometimes if you have, especially if you've taken cases which were handled by your students, and they give a lot of remedies, and they're good homeopaths, and they have tried their best, they've given the right remedies, but in their minds, but they're not really given the simillimum. They bring it to you, the case is confused. Actually, Professor Vithulka's seminars in Alanisas are only this kind of cases, where we all have messed up the cases and we take it to him, the cases that we haven't been able to cure, right? And I believe most doctors who come there are good homeopaths. So it's even worse when good homeopaths spoil the case, because they give very close remedies and they spoil the case very beautifully, right? This is the biggest danger. If you give multiple remedies, like some practices are there, you might see some change, right? You might see some change, but is it the right calculated change that we expect with a homeopathic treatment? That you have to think. In this group, you will easily change the symptoms and you will think you have done good if you don't know the theory. Without theory, you are lost in homeopathy. Okay. Now, in this, we don't go very high, 200 max, because like I said, the clarity isn't very good. You don't want to disturb too much with a wrong remedy. Final group, which is group D. Now, we came through the groups. Energy dwindle. Now we are in a group where the immune system is so weak that you will barely find any individual symptoms, right? So in them, prescription will be directed to palliation. You cannot hope much of a cure. Like I said, it doesn't matter what the pathology is. It could be a simple eczema, it could be Alzheimer's, it could be Parkinson's, Alzheimer's, multiple sclerosis, they all automatically become group D unless they are coming from, very few cases are in group A or B, but most of them fall in this group. And your cases where you will not find any individualizing symptoms. This is the group D, right? In 10, there might still be possibility of pushing them up to group C, that is level 9. But as you go lower, 11 and 12, absolutely no possibility for cure. We only look for palliation, and that has its own rules, right? Palliation has its own rules. And most of the times we'll be prescribing on the pathology, all the rare organ remedies and things like that. We will be prescribing in this group because we don't know where to pick the symptoms from. We don't see much. And usually these people will have very high hereditary load, a lot of cancers, lot of chronic diseases, neurological conditions, all these kinds, a lot of suppressions also maybe. Now, in then, of course, we don't have aggravation. Why? You see, the idea of aggravation is this. We are matching our remedy based on the symptoms of the defense, not on the pathology, right? So, those symptoms which belong to the defense and which belong to the remedy get augmented when the remedy is given, and therefore the aggravation occurs. In these people, we don't have any defense symptoms at all. We only have pathological symptoms. We only have the disease signs. So what is going to aggravate, right? Nothing is going to aggravate. The disease may worsen, but not homeopathic aggravation. You will not see in this group. And you will not go high because you don't have enough deeper symptoms to go high. You give physiological doses, right? Maybe even mother tinctures. Then, of course, in this group also, you will not have acutes. But this is where your initial observation on COVID we have to consider now. You see, in this group, if you observe development of high fever, right? A patient belongs to group D. You've been treating him, this person, you're just palliating because it's a very bad case. But then they develop fever. Then you can be sure that that's the end. They cannot recover from a fever. They have no energy left to combat or to manage that fever. Why do they get fever? Not like the group B or group A, where the body raises the temperature to combat the fever. No. This is a result of, in COVID, what happens? Those with good immune system have a Th1 reaction. Th1 or T helper cell 1 reaction, where the correct sequence of cytokines and immune cells are stimulated and person returns to normal. That's fine. But those in whom there is not enough defense, the viral load accumulates so much that there is a sudden and explosive reaction of the immune system after some time, what is called the cytokine storm. And this is a Th2 reaction, which is Th helper cell 2 type reaction. It is not healthy Th1 cell reaction. Now this is dangerous because cytokine storm means the cytokines which are supposed to be within a certain level increase exponentially and stimulate the body to react forcefully, even though the body lacks the energy to react. The virulence of the organism and the absence of ability to react, these two together in this group will force the person to react. And once there is cytokine storm, there is nothing much else left, right? And the fatality is decided in this group. So if a patient is in group D and they develop acute, you can tell the relatives to be prepared, right? So you see, just understanding the group gives you so much insight into what is happening with the patient, right? A patient with a chronic condition comes to you. The moment you take their case, their past history, their family history, how much exactly the person is suffering, what is the levels. You see all this, you get an idea which group he belongs, you immediately know what to expect. And when you give the treatment, what you are going to expect. Is acute good for him or not? Oh, simple question. You are treating a child for recurrent tonsillitis. Okay, you give the treatment, and then within 3 days, the patient develops tonsillitis again. Is this a good sign? No, right? It's so clear to you now that no, the patient was not helped with the remedy, because if the remedy helped, the problem should not have recurred. But if it's a group C case, right, and then you're treating a chronic condition, and then the patient develops, after you give the treatment, the patient develops severe tonsillitis, you are on the right track. You know now that you have brought him from a chronic degenerative state to an efficient acute inflammatory state, right? So just knowing, and this is just one of the things I'm giving you examples, right? Just knowing the levels, say in the first consultation, the level will tell you what strategy. If you have a group C case, are you going to look for peculiar characteristic symptoms? No, you may have to look for the totality, because not much is going to be characteristic. It will tell you the strategy. It will tell you the prognosis, right? Can we cure it outright? Does it need a long time? Yes. It will also tell you the potency. Most of the times, sometimes it, like I said, it's an imperfect science. It will tell you about the likely length of time, right? It will also tell you about the, on an average, how many remedies will be required. Because if you say you have a case in group C, you know you cannot tell the patient, I'm going to treat you now and your sugar levels will go fine. No, you know you will have the wisdom enough to tell, look, we start the treatment now, you will start responding, it will improve, but I will need to give you many more medicines in sequence before your sugar stabilizes, right? Or if it's a group A case, you give them and you tell them, don't come back, you will be fine. Just continue to watch your lifestyle, right? So the knowledge of level enables you to assess each patient according to the level. And in the follow-ups, the level will tell you what is happening. Like I said, now this patient had, tonsillitis, you gave the remedy, and then 1 week later, there is again tonsillitis, you know your treatment has not worked, right? You know the remedy has not worked. Whereas, like I said, in a group C case, you're expecting a very slow progress and the person develops tonsillitis. And you're like, oh, wow, that's amazing. You are going much faster towards cure than I expected. It'll help you decide whether to, I'll show you a case later, how that helps. It will help you decide whether you must treat an acute or not. Say you have a group A case who consults you from now, from time to time for this and that. And then they develop some cold and fever. What will you tell them? You tell them lots of fluids, rest. You don't treat them. Whereas group B case, if it is after treatment, the person develops acute again, you will decide depending on how severe this acute is compared to the previous acute, right? If it is as severe as before, you must treat. If it is much better, oh, at that time I would have this, that, now I'm okay, it's there, but I'm not that troubled. Wait, you can give placebo, whatever. But you know the remedy has worked, the patient will be better in the next level. But if you go to group C and you have been treating and the patient develops a fever, you know you have to treat, because the patient does not have the strength in the immune system to stabilize that state. He will immediately fall back to his previous condition, right? So just understanding the levels will tell you whether you have to treat an acute or not. It will also tell you whether to treat a new symptom or not. Many times, this is a very common experience. When you give the right remedy, within a few weeks or so, you will see a whole new set of symptoms, right? And the original symptom is gone, I mean, or better. Do you immediately change the remedy? If it's in group D, yes, because they don't, they're not constant with their symptoms. The symptoms are always changing and you must treat for every new symptom. But if it's a group C, in a group C case, you will say, wait, it has to stabilize before I see a clear picture. In group B, don't bother because they have the strength to stabilize themselves. Group A will not have this problem. So whether to treat a new symptom or not, and whether to change the remedy or not, right? If it is, again, the same rules. If it is group D, you need to change. In group C also, many times you will need to change. But group B and group A, if you know they are group B and group A, even in chronic conditions, you will say, wait, your body will heal. Your body will heal. You give 201 dose. It may take 2 months, but the patient will stabilize. Slowly, 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 patient will stabilize in group B. You don't need to change the remedy often. We have this tendency, I have seen this in a lot of good homeopaths, that they will be treating patients for chronic conditions. And when they come up with acutes, they immediately start treating the patient for the new acute without thinking whether this new acute, this new symptomatology needs to be treated or is actually a good condition and we must just wait for the immune system to start acting, right? We are not allopaths. We don't treat everything that comes our way. We go by the bigger picture. We go by our understanding of what is good for the patient's immune system, not by what the anxiety of the patient is about. The WhatsApp is filled with anxious messages. But doctor, this is the fever. Doctor, that again a 99 and they're giving them paracetamol. But this is not, or because you don't want them to give paracetamol, you give belladonna. This is not the right kind of practice. You have to have clear understanding of where the patient is. And if this patient is in this level, will he have a clear symptom enough to give belladonna? Many times in acutes of group C, we don't have clarity of acute symptoms. So what do? Right? These are strategies that are taught by Professor Vithoulkas, that you have to be meticulous. You're not allowed to play with a patient's life. Right? You have to be meticulous. You must know, like calculation, mathematical calculation. This is why I'm giving this remedy now, and this is what I'm expecting. And if this doesn't happen, what is the problem? Right? You have to triangulate all the time. And only then you can have a scientific approach to homeopathy. It's not, whims and fancies of people. It's a very calculative work. It's a lot of hard work. Sorry. Anyway. Okay, levels of health theory and all that blah blah. We are homeopaths. We don't want theory. Give us cases, right? So let me give you working examples of the theory. Just let me a moment. Yeah. So first case. Now, what am I going to do in these is that you will see two cases of the same pathology, but of different levels. There's a very simple example. For some people who attended our conferences, it might be a repetition, but I like this example because it's very obvious. It's easy to teach with, right? So if you sit down in clinic, with every case we do it, but to teach in a platform, this is easy. So I put up the same example. Sorry if it's repetition for a lot of you. Now, so I said, the pathology that I have considered here is psoriasis. Just a moment, sorry. So we will be seeing two cases of psoriasis. Like I said, same pathology, but different level. I hope you will follow me better when I follow the whole idea better with this, because it's a very practical thing. So the first example is of a 41-year-old man presenting with psoriasis since 1 year and not responding to even methotrexate. He was given methotrexate. And other than that, he had headaches, recurrent headaches, which begin on waking up in the morning. I know already many of you are thinking of remedies. Sleeplessness with too many thoughts crowding his mind at night. I'm not going to go into details of repertorization. You can do it by yourself. I know. That's not the point. The point is about the levels here. That's all. Okay. And the past history tells me that he had recurrent high fevers 2 years back, treated heavily. Every time he had a fever, he would take antibiotics. And that was 2 years back. And the psoriasis is since 1 year. Before the psoriasis began, the fevers had stopped. They were not coming for almost a year, and then the psoriasis began. And in childhood, he had some recurrent cold and cough, otherwise generally been healthy. Now, family history says parents are very healthy. They're in the village. They have no health issues. They're very healthy people. So don't bother putting in a specific level, but generally think, is this person of a good health level or low? He has a chronic complaint. Yes. He has a chronic complaint, which is an autoimmune condition, right? But you see, he had high fevers until the onset of the chronic condition, which means he has just dipped. He's just there in the group B, lower. He's just dipping, and if this continues, if the medication of methotrexate, everything continues, it will make him worse. But something interesting here. Despite giving chemotherapy drugs, this patient's psoriasis did not go away. Does this happen with a strong immune system or with a weak immune system? Think about it. Obviously, with a strong immune system. If the immune system was weak, any slight ointment, steroid would have taken away the condition. But because his immune system is so strong, despite such heavy drugs, it is still maintaining the same pathology. It did not get suppressed, right? So this indicates to me that the patient is of a good health level despite having an autoimmune condition. Now we know immediately that this person will respond very dramatically to homeopathic treatment, right? And usually there won't be any family history in these people. Parents are healthy, but there will be some triggering cause. And when I spoke to this patient, he told me that he has had some issues with the job, and he has some grief which had affected him, and that is when he started having the fevers. And once he suppressed the fevers, the psoriasis began, right? There is no family history, healthy background, and then autoimmune condition, still good health level. Are you following till now? I hope. Do we have that thumbs up reaction? Sorry. Okay. Anyway, where were we? So, yeah. So this is the patient on 21st of Jan. Okay, this was the condition. Despite having chemotherapy drugs, this was the condition, right? And then the remedy was given, Natramur 1M was given, 1 dose was given. Immediately, he had severe itching aggravation for the next 1 or 2 days. He had severe itching, right? He called me, he said, "Doctor, I never had so much itching. It's intolerable." I said, "I have no other way. You have to give some hot application, apply some coconut oil. You keep them engaged till the aggravation comes down. But other than that, there was nothing else. But once the skin started becoming better, he had a high fever. Now, should I treat this high fever? What are the rules? The patient came to me for psoriasis, right? And then I know I have given him a certain remedy, but because I know he's of a good health level, I know his suppressed condition will come back. When do you treat that suppressed condition? If it comes back, only if it is strong enough and gives you a clear picture. Otherwise, don't touch it. Because he's of a healthy level, the fever will run by itself and he'll be 2 days he had fever, third day he is fine, right? So once that happened, and all this happened in 3 months, immediately the skin started getting better, he started getting he had a fever episode, all this in 3 months, just one dose of Natremure 1 ml, and this is March. See, right? Now I can put this up on my clinic, what I was saying before, after. Until today, I follow usually with a lot of blood markers. So we had to do a CRP for him and everything to see if there is inflammation. Till today, his whole family takes treatment from me. So I did it even last December. I think his CRP is still normal and no skin complaint. Right? He still has a stress, but he has no problems anymore. Somebody's mic is on. Is there a question?
Questions we can take in the end, but there are suggestions as you see. They're telling not to treat the fever, so suggestions are coming.
Oh, okay. I cannot see the chat box.
Okay.
Okay, I'm happy they're
Yeah,
participating.
you put your queries. I will tell what is the reaction.
Yeah, okay. Yeah, that will be good. Yes. Okay, I will stop my questions because I'm not expecting an answer. I go on.
No, it
Okay.
can be interactive.
Okay, excellent. I'm happy. All right. So this is what we call miraculous. Now, this patient did a lot of marketing for me, but this is not possible in every case, right? The second example we will go is the scary one, right? So this patient also is 42 years old, psoriasis of the scalp, right? He also has hypertension, no acutes since a very long time, since he cannot even remember the last high fever he had, and then some boils in childhood. He's a very sensitive, touchy person, and nothing much, no clear symptomatology to begin with. Okay. Then he went through a lot of issues. His first wife died, and children are there, and lots of complications, and that's when all this began for him. But he also has comorbidities, right? He has hypertension, and his family history. I've not put it here. Okay. Father has diabetes, not very healthy person. Mother has rheumatoid arthritis, right? So family has a lot of chronic health issues. Then no acute or fever in the recent past. So automatically, homeopathically, we know at the levels of health wise, we know that the level is lower. And this is going to be a difficult case, right? This much we understood till now. Now, what happened was that initially for the 2 years, treatment was on, and we gave him a lot of one after the other remedies and all that. And then he underwent severe stress. He got laid off, okay, at office, and there was a lot of stress, and the psoriasis spread massively. Okay, and this is called erythroderma. Erythroderma means the whole of the skin gets affected, becomes red and inflamed, and his blood report showed sepsis. You know what is the septic state, right? You have a high WBC, The N/L ratio is very high, the ESR, the CRP, everything is very high. Patient is in sepsis. And this is when he is on homeopathic treatment. Now, this person's father is an allopathic doctor. But this patient said, I am not taking any other medication, you have to treat, right? So Mahesh lost 3 kilos in 1 month when he was treating this case. It was that stressful for us because you know what can happen in sepsis, right? Now this is, I will show you the picture later. This is tremendously spread psoriasis infected in sepsis, right? So the sepsis came down, but there was a palm-sized abscess on the abdomen which did not open up for 3 weeks with any treatment, right? And eventually we wrote to professor and he prescribed and he was out of danger. He would get fevers. Okay, now if you don't treat this person during fevers, you are in for trouble, right? So what happened? Let's see, I will show just to keep it. This is the erythrodermic change in psoriasis. Now, this person, it's actually affected here, here, on his limbs, everywhere. Okay, you can see the thickness of the lesions, the putridity of the scabs, and what happened next was, you see this part, this is the abscess. Okay, and then this whole area is the abscess. It drained. Professor prescribed sulfur 201 dose, and within an hour it drained. It hadn't responded for 3 weeks, and sulfur 200 was professor's prescription, and it drained in 1 hour, and about some 500 ml of pus came out of here, you know. So yeah, this is a miraculous case in its own way. But what I'm trying to say, if you consider this also as psoriasis and the first case also as psoriasis, you will be how the conventional medicine considers both as psoriasis. But with a knowledge of levels of health, you will be able to tell which is more serious and which is less. Now, though this person, of course, this is after 1 month of treatment from professor, it is even better now, but not completely cured. This is 2017 story. Even today, we are treating him, right? For a lot of lesions, they're small, and all over the place, not continuous like this, but still under treatment, not gone, right? So, because we know the levels of health, because it is the moment the patient developed fever, this is not a good condition in group C. If it is in group A and B, like in the first case, which was a group A case, right? Patient will be fine. It was a group A case, pushed down to group B when he had fevers, but he went back to group A, all in 3 months. This over 5-6 years we have been treating, but it's not gone, but it's not bad. That's the state. Then in that case, we used only Natramur 1 mg, 1 dose. In this case, we have been using quite a few remedies. Sulfur opened up the abscess, and then he had to go through the whole cycle, and then Heparsulf, and then I am not sure what remedy he's on now, but we have been giving him one after the other. Every time he gets a little better, the remedy picture changes and we have to give a new remedy. It's not possible to see cure, what we term cure, with 1 remedy or 2 remedies in such conditions. These are really bad cases. So what we understood so far, same pathology, different level, different approach, different prognosis. Why different approach? Because in the first case, we went by a few characteristic keynotes. If you go to repertory, sleeplessness due to thoughts crowding and grief and headache on waking, Natramur is the remedy that will come up. So just 2 or 3 or 4. Usually you need 3 keynotes. You don't prescribe under 3 keynotes. Don't never prescribe on 1 or 2 keynotes. It's going to be a mistake. You have to find the supporting keynotes. But in the next case, the second case, there are no keynotes, right? You have to take even the sulfur prescription for that specific severe state when the abscess opened up was on totality, not on keynotes. Okay, so every time we take the case in the second instance, we have to take the totality, because we are not expecting, if he starts putting up keynotes, then he is ascending in the level of health, and we can be happy about it. So different approach, same pathology, different level calls for different approach. The prognosis is different. The remedies and potencies is different. Here we give 30 or 200 max. Sometimes we've even given him 12, right? But in the first case, 1 m, 1 dose, right? Duration of treatment is different, and implication of an acute is different. In the second case, when fever came, we were not happy. The first case, when the fever came, we were happy. So what an acute means in each condition, in each level is different. And unless we understand this, we will make a mistake. So finally, what I want to say is that understanding of levels of health is imperative to homeopaths if we are to understand how to deal with cases and to interpret what is happening in each case. One can begin by applying the assessment of levels to every case and see how it changes one's perception and prescription. It's a lot of hard work, but once you make it a habit, it becomes, after some time, it becomes a subconscious habit. You do it automatically. Your assessment of the first consultation, what the indication is telling you, many times the diagnosis and the problems are missed by the allopaths. But we homeopaths can identify that this is not simple. I had one of my patients' father-in-law, not in this town, but in another town, was admitted due to epileptic seizures. Apparently, he used to have epileptic seizures before, like, when he was a child or something, and it had stopped. And now, suddenly, he's 70 or so, he suddenly developed epileptic seizures, and he was admitted. And then she gives me the history, and she gives me what they have diagnosed it through EEG and CT that it is, and it is not Bangalore, it's some other smaller town, that it is just epileptic seizures. Okay, and they have they have given anti-epileptic drugs, and they're just observing. But she says he is getting worse and worse. Even with anti-epileptic drugs, his seizures have not stopped. The moment you see the history and you see the family history and what the patient has suffered, and I was like, oh, I don't think this is simple epileptic seizures. They have missed something. But by the time I could, I was trying to coordinate with an enhanced neurologist to see the reports. By the time we could coordinate, the patient expired. This is not some superpower. No, this is pure hard work, and are trying to understand what is happening with patient. And this is something we learned from our teacher. Even today, 60 years down the line, when he takes a case, he is not making guesses. Right? Even today, he sits down diligently with the repertory, takes the case in detail, tries to fit the whole picture. And levels of health gives a huge certainty, a huge level of certainty to your understanding of what's happening with the patient. And I believe, at least I'm a very skeptical person. I'm not somebody who will just follow or just taught to me. I question, I do my research. But levels of health and continuum theory both have proven their mettle in every case for our practice. So I would suggest that, of course, it's available as a book, and you can take the course also online. I'm not talking about that now, but I would suggest that this is a very important concept for every homeopath to understand what is happening with the patient, beginning and later. So my gratitude to my teacher. I am what he has made me. So I'm thankful to him for everything. And what's the time? Okay. Any questions? We can take the questions now.
Thank you, ma'am. First question from Dr. Helen Poff. What level and group does the mental health disease like anxiety neurosis belong to?
Okay. Like I said, specific diagnosis is not going to help us pin a level. But generally, mental and emotional diseases, if they are by themselves, the worst problem, the most difficult problem with mental emotional diseases is that, when I said pathological signs and homeopathic symptoms, right? Like in diabetes, we can differentiate them. But in mental and emotional diseases, it's a problem because you will tend to take the pathological symptoms also as homeopathic symptoms, right? So it's a very tricky business when it comes to mental emotional pathologies. But what do you say, the things that help you to pin a level is the concomitant problems. You have to go by the bigger picture, right? Not just the diagnosis, but you have to see, is the patient having this mental health problems because of a simple something going wrong in their life, some circumstantial stress, right? Or is it because they have a familial tendency for it, or they have certain suppressions in the past which have led to a deeper problem now? Along with that, the easiest way to recognize is, when was the last high fever, right? So if it is accompanied, if they still have high fevers, then you go group B. If they have very heavy familial tendencies, then you go to group D usually. Or if it's because of circumstantial stress and there's a lot of general symptoms of, say, panic and things like that, then you go group C. So it is not the diagnosis, but the reaction of the organism at that point. So what is concomitant diseases? What is the family history? And the past history. Have they had many other problems, suppressed, and then landed here? Okay. So you have two cases of the same pathology. One person has a very strong suppression history. He had skin problems, applied something, then he had rhinitis, took a lot of antihistamines, and then now he has anxiety attacks. Another person did not have any such history, and then suddenly something happened, he landed in anxiety attacks. He has nothing else behind or to get along with his condition. Who is sicker?
Thank you, ma'am. Another question from Dr. Geeta Shah. When
No,
person has
wait, I asked a question. Who is
yes,
sicker
yes,
among these two? Can anybody try? Is a person with history of suppression sicker, or a person who landed directly in a chronic degenerative disease or a psychological disease sicker? Who is sicker? Whose health level is lower?
Uh,
suppression one said by Dipti, ma'am. And the
Suppression
person with
is
suppression is sicker. Yes.
okay. Somebody said second case is sicker. Okay. Think about this. The person who had suppression,
Sure.
yeah, okay. The person who had suppression originally was not going to have anxiety. He was going to have skin condition and he was going to have rhinitis and things like that. Because he mishandled them, he landed in anxiety, right? So this person is healthier than the one who directly lands with an anxiety case, right? So when we analyze what has happened rather than what is just the diagnosis, what has happened in the past to this person, then we know what is the level. I hope that clears the question. Okay,
Yeah.
next question, please.
Thank you, ma'am. The doubt from Dr. Geeta Shah, when person has low immunity but it has cancer, and what about the energy of the person?
Uh, Sorry, I did not understand the
It's
question
just
fully.
mentioned like it's when person has low immunity and it has cancer,
Hmm.
then what about the energy of the person? If the person has cancer and low immunity, what would be his energy?
Ah, okay. So low immunity itself means low health level, right? So it automatically translates to low health level. There is no question about that. When they have it's not cancer, but the low immunity which decides that the person has low level, is of low level. Okay.
Okay, ma'am. Dr. Diti asks, if this person had come for the homeopathy treatment after suffering from psoriasis, will the level
Hmm.
of health still be higher?
After, sorry, you were breaking a little bit. Can you please repeat?
Sorry, if this person had come for the homeopathy treatment after more years of suffering from psoriasis,
Hmm.
will the level of health still be higher?
You mean the first case? That's an
Yeah, yeah,
Yeah.
yeah.
interesting
Yeah.
question.
Yes, yes, yes.
Uh, if he had, if he had, if the treatment that he was taking had succeeded in reducing the lesions, then his health level would be low. If it still maintained the same intensity despite taking a lot of treatment, then the health level has not reduced. It has still stuck to what it was in the beginning. But once the original pathology for which the treatment was being given goes away, that is when the level reduces. Okay?
um, I have one query. It always on my mind, like when we talk about levels of health. If a child or a adolescent is all through healthy, no childhood infections or anything like that, but obese,
Hmm.
so which level of health we can take them to?
Yes, this is typical of homeopathic children.
Yeah, exactly. Very true.
I know, because they have not been given any drugs all through life. Uh, See, there are two things here. You can have diabetes as a result of lifestyle. It is possible, correct? But as a result of your other, problems, genetic and all that. All this is possible. These children are basically healthy, okay? But because of the kind of lifestyle, they have obesity. Problem with obesity is it itself induces inflammation and it can lead to other problems by itself, later reducing their level. At the moment, when they're usually when they're children, adolescents, they're fine, their health level will be good, right? But once they become adults, once they start stressing themselves, this background of obesity which has started the inflammation will start to act at that time. At that time they will need treatment. So homeopathic children, I mean typically children of homeopaths, okay, I have seen that they will otherwise be very healthy if they have been given the right treatment, but they may have this problem because of the kind of lifestyle we have. They're basically healthy.
Yeah, even homeopathy also very less. They haven't received much.
Yes, yes, I know.
Yeah, that's true.
No,
Very
that's
nice,
good.
very nice. It
That's
was
good.
so awesome. Yeah,
Yeah. That's good, but
awesome explanation.
yeah, make sure they move about.
Yeah, yeah. That's a quite challenge. Yeah, right.
Yes, yes.
And many questions are coming up, I think.
Yes, ma'am. Solution for congenital peritoneal hydrocephalus in a 6 months old baby.
Mm. Okay, so these children, we have a published case of hydrocephalus in HPathy, I think. You can go through that. Um, hydrocephalus is not by itself a disease per se. It's a more structural problem usually. And what we have seen is once it is reduced, if it's not coupled with any other, AV malformation in the cranium, usually it will respond very well. But if it's so, okay, so if the tension in the cranium is too high, you use the procedures. But if it's not too high, homeopathic medication will help, and we've seen very good results with it. And by itself, it's not a very immunity lowering problem. It's not. The children will be fine.
Thank you. Another question, how to proceed the case taking when the patient in group C says there are no health complaints he or she has. Just minor complaints are present for such a patient. How to proceed this case?
You have to wait till they get a problem. Yeah, that
Should I
sounds
repeat,
very.
ma'am?
No, I got it. I got it.
Okay.
What I'm saying is you'll have to wait till they actually land in a problem, right? Because they are group C by your observation, by your knowledge, yes. But if there is no health issue, homeopathy has no role. Homeopathy can treat diseases, it cannot treat imaginary situations, right? It cannot treat something that is not there. So you have to wait. You keep it in your mind that this person is group C, and they will eventually come out with, and you can catch them early whenever it is, come out with, such people are the ones I usually say, they're usually the spouses of the patient or something like that. I know they are group C by how they describe themselves, but they don't have any issues and they're very proud of it. Professor Vitulkas calls this immunological silence, and the body is preparing for a disease. It does not react, it does not have fevers, no reactions. Person will appear healthy, and then something starts, right? So you make these people undergo regular health checkups so you can catch them early. That group C people, this is a group C person, you're expecting some problem in him, the family history. So in that line, they make them go through regular health checkups, not group A people just because they're old. No, they'll be fine, right? If we go also, they will be there. That's how healthy they are. So don't bother over those people. Group C people, if you have not seen obvious problems in them, keep them on a tab. That's very important. And that's what I would suggest. Don't treat them. It may look very arbitrary when I talk about the levels, but actually, when I have gotten into this study, for example, there was a study about multiple sclerosis patients and their susceptibility to viral diseases. Now, they studied a particular population where they compared the viral infections in healthy subjects and those affected with multiple sclerosis. It's Sibley et al. 1985, I think. They found that people with multiple sclerosis did not get viral infections as much as the healthy ones, and the sicker they were, that is, there is something called EDSS score in multiple sclerosis. The worse the score was, the lesser they got the infections. So this means, and they finally conclude that multiple sclerosis renders a protective effect on the patients towards viral infections. So it's not arbitrary, it's not imaginary, it is actual practical observation. So you would do well to understand these concepts, right? Next question, please.
Is fever an important indicator of prognosis, or can it be even appearance of older acutes of the past?
Yes, both are in the right direction. But as I said, group D, no fevers, please. Group C, if you manage to elevate their health level, they will produce fever after enough treatment. Group B, the rule is they should not get similar, the same intensity of acute after your treatment. The frequency and the intensity should start reducing, right? So even if they get a high fever, the suffering should not be the same. The number of days they suffer, the amount of infection, the inflammation should be low. Fever will stay. Fever is a good indicator of good health level. So is return of old complaints. Return of old complaints, we know it's an established fact that it is the right. The biggest problem today, one of our colleagues is saying that the biggest problem in our clinic is battling with skin conditions that come after treatment. This is like one of the most problematic situations, right? So this we know, and it is a good prognostic indicator. Next.
Thank you, ma'am. Ma'am, in spite of giving strong cancer medication in the case 1, he didn't respond or better. Just a minute. Can we take it as a rule that if anyone doesn't respond to strong medicine, can we think that they are in higher level of health?
Yes, absolutely. Absolutely. You see, in the higher level of health, the immune system is so strong, no matter what you give, unless the right medication is given, the one that supports it, it will not budge. It will not go away. When you see this, when you see that despite that much treatment, same level has been maintained. The patient has not gotten worse, not gotten, clear of it, right? The constitution is strong. It will not easily wobble. It will not easily succumb to, because these are really strong chemicals. And despite that, it is maintaining it there, means it is because you see, okay, at the level of tissues, what it means. All the chemotherapy drugs are, one is they are directed towards fast dividing cells, right? And second is there might be some anti-inflammatory action. Now, the problem why they give the chemotherapy drugs to psoriasis is because it's the same problem. It's not cancer, but the skin, the cells of the epidermis are, they are, multiplying too fast, right? The cell cycle, which has to go through certain number of days, I've forgotten, of becoming of replacing the top layer, that is too fast in psoriasis. So that is why they give methotrexate, which is directed at halting these cells which multiply too fast. Despite such a heavy drug, it is still multiplying. It means it is not succumbing to the effect of the chemical, which shows how strongly it has established itself in that layer, and it has established its new homeostasis. This indicates a very strong constitution and a good, comparatively good health level. Next.
Will group C people be the most likely group to see the most beneficial group to revive no-so treatments in order to be an intercurrent, to see the layer, to bring out the symptoms to the surface when we have standstill but totality matched?
Would group C people be the most
Helen
likely
Poff, yes, yes.
Group to see the most beneficial to receive no-so treatments in order to be an intercurrent? To see, okay. See, this is a concept that we do not understand, intercurrent remedies, because unless you have indication, there is no treatment in homeopathy. You cannot assume that this is the miasmatic background, so this patient will need this remedy, so I am giving. This is a lot of your mental work, not what you are observing in the patient. If the patient indicates medoranum, perfect, give him. But without indication, you cannot give any remedy. Doesn't matter, acute, chronic, intercurrent, I don't know, they have a lot of names. It doesn't matter what name you give them. The bottom line is you have to have indication, right? Even when you are going to give no sods, you have to have indication, right? And what I think you mean to ask me is that when there is a stagnation, does the group C benefit from no sods? This is a very I cannot give you case examples of or proven conditions of this. Maybe my problem. I'm sure there are a lot of doctors who can do that. But the problem with that is you do not assume that this patient needs this. If there is a totality that is indicating a remedy, yes, it will move. It will shift the case. Many times, why we hit a plateau in a patient's treatment is because we have not analyzed the case properly. If you see Kent, he tells you we should go to the beginning of the problem. We should not always take the what is presented to us, because what is presented to us may be coming through a lot of other treatments, right? So it will be useful, it will be beneficial to go back to when it started and take the original symptoms and prescribe. So you have to always, like I said, you have to keep triangulating. You have to keep thinking, what are you missing? Is the remedy action correct? Why is responding? You cannot assume anything. There is no shortcut. You have to always analyze and see what is indicated at the moment, and only that works. Nothing else works. If it works, it may, in group C, I said it will shift, it will change, but not really cure the case.
Okay, ma'am. I hope this will be a last question. What would be the possible level of health for secondary infertility where the patient suffered from stillbirth at 9 months of pregnancy, got obese with uterus prolapse after the first pregnancy with the history of urinary retention?
This is a structural
Quite big.
problem. Yeah, this is a structural problem as I see. Uterus prolapse after first pregnancy with history of how the uterine prolapse is.
Just now put it in chat box, ma'am. You can see it.
Yeah, I'm seeing. How did? Okay, the stillbirth was in the first pregnancy, right? This seems to be a very structural problem. We would say lower group C or upper group D. Of course, I need a lot more information than just this much. I will need her mental emotional state. I think this is a mental emotional condition, this person. But of course, we do not assume, we do not imagine. We have to go by what information we have. We have to see the family history. We have to see what was the past history. Probably, but by what you have told me, I think it's lower group C or upper group D. Difficult case, I would say. A lot of infertilities are easy, but such conditions, we have to be careful. We have to see a lot of other information before we decide.
We have few questions in YouTube Live. What will be the level of health of an autistic child with no physical symptoms?
Autistic children, if they have physical symptoms, they are of good health level. If they don't have physical symptoms, it's pretty bad. Group D upper or group C lower. When they have physical symptoms, we have seen this especially. Okay, this is another established study where they have seen that when autistic babies or autistic children develop fever, their behavior becomes better. This is established, not homeopathic. It's conventionally established that autistic features become better when the child has fever. What does it tell us about that, right? So if there is a possibility for fever, there's a good possibility for homeopathic treatment in these conditions. But if they are not having any physical complaint, it's a pretty bad case. It's like there are no individualistic symptoms, only the autistic features.
I think
we are past time.
yeah, past time. And any more queries we will be sending to you so that we can
email.
answer
Yeah, sure.
Even you can share your email or
Yes, I
mobile
can.
number so that
Where shall I type it? In
people
the
can
chat box?
connect. Yeah,
Okay.
and that was really wonderful session, Dr. Seema. And when I was teaching my daughter about Kent's lectures during influx, I could see the seeds of levels of health, how Kent
Yes.
talks about levels of health. And it is so wonderful that our professor has made it practically possible
Yes.
to inculcate in our practice. And yes, what you told is really true. This theory is really practical, most practical thing, and
Yes.
very, very beneficial. And I hope each homeopath gets it in his
Benefit of
practice,
it. Yes.
and that is the aim. And no words to tell it how awesome it was.
Yes, please
Thank you
do.
so much for being here and sharing your knowledge.
Thank you.
And IHMA has been doing all this. It has been the voice of homeopaths in India as well as internationally. It's one of the largest associations
Association.
and doing philanthropy. And we are from Tamil Nadu chapter, and it was awesome hosting you. And I want to thank you and as well as Professor. Is
Yes.
so wonderful,
Yes.
wonderful person, a genuine. What to say? Is a
He's everything to me.
yeah for most of them
Yes.
like us, and it has been wonderful. And I want to thank our participants who have been consistently there and interactive and
Yes.
very, very knowledge seeking. That is
Yes.
the best thing about IHMA webinars.
Yes.
And
Absolutely.
tomorrow also we are hosting one veteran, Dr. Kishore Mehta.
Mm.
Please stay tuned, and thank you, Ananda. I think we can wind up.
Thank
Thanks.
you.
And say hi to Mahesh.
Okay.
Yeah, we met him in Greece.
Alonisos, yes.
Yeah,
Okay. Bye.
yeah. Bye.